UN Human Rights Council resolution recognizing neglected tropical diseases as a human rights issue. Backed by 6 African countries and led by Malawi, the resolution calls for stronger action to tackle the diseases which affect more than 1 billion people worldwide by addressing the poverty, inequality, and lack of basic services that allow them to persist. Well, for more on what this means, we're now joined by His Excellency Pacharo Kayira, who's the Deputy Permanent Representative and Acting Head of Mission of Malawi to the United Nations in Geneva. Thank you so much indeed for joining us, and a very warm welcome to you.
Thank you very much, sir.
So, to begin with, why was it so important for Malawi to lead this landmark resolution at the UN Human Rights Council?
Thank you very much. Malawi has a direct and lived experience on what a rights-based approach can achieve, because as a country, we eliminated trachoma in 2022 alongside with leprosy. And that was done through sustained political commitment, strong partnerships, and comprehensive approach. And this approach basically addressed both the diseases themselves as well as the conditions that allow such diseases to persist. So that experience showed us that eliminating NTDs is really not a public health issue to be left to the Ministry of Health only, but rather it depends on a very coordinated approach across government ministries, departments, and agencies. And also, it also requires the recognition of the dignity and the rights of the people affected. So as a country with a huge burden of NTDs, we thought that the human rights approach in the council would be very, very important. And alongside countries such as the Gambia, Kenya, Tanzania, and Morocco, as well as Burkina Faso, we thought that we could lead this process on behalf of about 1 billion people who are affected by NTDs.
What difference do you think human rights recognition will make?
Well, the difference that the UN Human Rights Council recognition will make is that, firstly, it brings the resolution brings the issue to the pinnacle of the UN human rights system. The Council is the leading body of the human rights, the leading body on human rights as far as the United Nations is concerned. So it brings the issue at the very top of the Human Rights Council agenda, firstly. Secondly, it gives an opportunity for political will to meet with what is being done at a public health level. And then it also brings in the aspect of human rights, that is the dignity, the non-discrimination, and the socio-economic advancement of people who are affected with NTDs.
Yeah, sometimes we don't link these things directly, cause and effect. The resolution says that these diseases are driven by poverty, things like poor sanitation, inadequate housing, and limited access to healthcare. The last one I think a lot of people will get, but the connection with the other three probably is what we don't often talk about. And this is why I'm thinking that this recognition and this thinking is critically important.
Yeah, it is. It's because you have to look at the people who are affected mostly by NTDs. Who are they? In what conditions they live? And you find out that they are mostly people who have been disproportionately affected, living in poverty, in remote rural areas, in formal settlements, and other situations of vulnerability. And these are particularly women and girls. So that's the profile of the people who are mostly affected by this, and they lack basic services such as access to safe water, sanitation, adequate housing, education, and that. So by bringing this issue to the council with a human rights angle and perspective, we are saying that these people should not be discriminated against. These people have the right to access better services so that entities are dealt with and eliminated.
So the resolution calls on government to increase technical, financial, and capacity building support. I guess the $1 million question is, do you think that there's enough political will and funding to actually make this happen?
Well, there is growing political will. Whether it's enough, I think it's something which can be worked upon, but I think this is a good start. Firstly, the WHO has been working on NTDs, but by bringing it to the council, we are basically amplifying that political will. Um, in terms of funding, we hope that by raising this issue at the council and saying that this should not be treated only as a Ministry of Health issue, a public health issue, and bringing in the human rights angle, we believe that that will not only amplify the political will, but will also unlock coordination at state level, will unlock coordination at regional level, as well as at a global level. And that ultimately, trust should be able to release some of the financial requirements for the prevention and elimination of NTDs.
Your Excellency, thank you so much indeed for joining us and for Malawi to lead this important initiative because for sure there are billions of people who will be affected, hopefully for the better as a result of this recognition. Thank you so much indeed for joining us and giving us some insight on this historic moment.
Thank you very much. Much appreciated.
Pacharo Kayira, who's the Deputy Permanent Representative and Acting Head of Mission of Malawi to the United Nations in Geneva, speaking to us about the adoption of the UN Human Rights Council's first ever resolution recognizing the links between human rights and neglected tropical diseases. And so that brings our time to 7:30 Central African time. And let's go to the news desk for the news headlines with Jwalani Tulo Ngwepe.
SABC